assume that maybe the briefing with the AG and the audit committee is going to be long. But then what we normally do is that as soon as we finish, we always make a request that those that are available, especially if the minister and the HOD are available, we can just call them in, we may call them in and then continue with the meeting.
Yes.
Okay, if the minister is in and the HOD is in, and I take it the rest of the department is in, we are now going to start with the second part of our meeting of the Standing Committee on Public Account of the Western Cape Provincial Parliament for purposes of look into the annual report of the Department of Health in the Western Cape. Now, the meeting itself is an open meeting, meaning that it is open to members of the public. After we have finished questions as members of the provincial legislature, we will allow an opportunity to those members of the public who are present, who have indicated or indicate that they would like to ask questions. The notice for this public meeting of the Standing Committee on Public Account was advertised in 3 newspapers in 3 languages. In Afrikaans, it was advertised in the Burger. For English, it was advertised in the Ergels. And for isiXhosa, it was advertised in Fukani. So the meeting is now open. Let me make use of the opportunity once again to welcome the department led by the Honorable Minister as well as the HOD. Now, I want to check whether are there any opening remarks Honorable Minister would like to make.
Thank you, Chair. Again, I'm sorry for the confusion because now I was on my way. I'm coming from the house on my way home to do some stuff and then have another meeting. So I was just preparing myself for the 3:45. So at this stage, I don't have the documentation in front of me, but probably by the time the department have spoken, I'll have reached home so that I can take it because it's in the boot. But with the welcoming, I think it's the same welcoming that I shared it at the Standing Committee for Health, that this year under scrutiny is from the 1st of April 2020 to the 31st of March 2021. So it's one of those years that we'll never forget. It's one of those years that you want similar thing happen to health system because it was the worst year for us. Worst year, I also made an example of using the good, the bad, and the ugly, or the bad, the good, the ugly, and the good. It's about the bad. It's about we lost staff during the second and the third wave. The worst one was the third wave. In addition to that, the mental wellness of our staff is still, even we can feel it even now, because they've lost some, not only their relatives, but also some of their colleagues. It's the time that whilst we might have had so many plans after the 2019 elections, but our dreams were deferred, where we have to deviate and render the health system differently. Meaning also in regard to the financing, because I don't want to talk about the clinical part, I want to zoom to what is relative in terms of the scope. Even for the management of the finances, also things went differently. Because by the time the National Treasurer came up with the directives, already we were to make things happen. For example, in regard to purchasing the PPEs, in as much as that you find that some of the time that some of the service providers might not necessarily be on the data list. So by the time that June, I think that was during June when now the National Treasury came up with all some of these processes and also the directives or the instructions, already the horse was already bolted because we had to save lives. And then also on the issue of even the SAPRA at the time and some of also the other processes and also other sectors that needed to benchmark on what we're supposed to buy, what type of K95 and all of those taking note that we're dealing with a pandemic or a disease, a virus that was unknown. So meaning that we have to work on what we have, and then down the line, things change based on the evidence that was in front of us. And then there was also when the National Treasury introduced in parallel that we have to conduct the COVID auditing in addition to the mainstream auditing that we are used to. It put too much pressure on the department. You can ask the chief director for supply chain. She will tell you that where now things have to be done differently. You have to start with all those stock which we had. Starting initially when we had it in our depot, where things have to be analyzed throughout. And I'm sure even post this budget here, they'll tell you about now they are busy with the vaccine in terms of the auditing. So that also put too much pressure on our staff. Where you have to, it takes only a month to build an 860-bed hospital. In an environment where actually there was no hospital, not only the hospital, but also bringing the staff for the food and everything, where you have to done things within that kind of a turnaround. In addition, that in some of the other hospitals where they have to create like a converting a lecture hall, the storerooms, the boiler rooms, in addition to that. So some of these were not necessarily within the normal specs or framework on how we used to deal things within the PFMA and all of those. So we have to dial whatever we must in order to save lives. So surprisingly, it was a surprise actually for me that we ended up even having even the clean audit under the circumstances. So thank you to Dr. Klute and his team. Not only the top management who's here, but the whole of even other staff who might not necessarily be involved on the nitty-gritty of the financing, but as the internal control face, they did a tremendous work in regard to this space. So thank you very much, and also for that, even at the time that even the finances were not there, earlier, because if you recall, even when the president came, promise of money, we never received any money. So it means that we have to rob Paul and pay Paul in within our own budgets. Because even when the National Treasury Finance Minister did the budget in terms of the deviations related to adding more money to the grants, COVID into the HIV grants and all others, we were already being dubbed as the Cape Wuhan because we were the epicenter. Therefore, there was no way to wait when we had our first case early March, and then up to the time that now we have to continue, because I think it was towards the end, early July or end of June, when now there was a confirmation of some monies that we are going to get through the grants from the Treasury. So thank you, team. And lastly, we lost as many people through the retirement, like Dr. Beth Engelbrecht, who was the HOD, and then the new HOD who came at the time that we're dealing with this pandemic. So he had to baptize in this kind of a context. The CFO also at the time, just mentioning people that are directly relative in terms of what we are discussing and that we lost. And even though also a newly appointed person was involved with the finance, I think chief director of the finance, who passed away. So things have been hectic. We came from a long way, but one thing for sure, there are lessons learned, especially where we are saying that no matter what, at least at the end, we are still have each other. We are still a team going forward. Thank you, Chair. Over to Dr. Klute. Can people hear me? Because I'm speaking on the phone. Okay, thank you.
Doc, you are on mute.
Thank you, Chairperson. May I proceed?
Yes, Doc.
Thank you, sir. So thank you very much for the opportunity, sir, and for the committee for SCOPA, for us to be able to come to you to account for this year under review. And really for me, it is just, I would like to take the opportunity to just introduce our team to you. So from the team, the senior managers that is here with me and their respective teams. So I will start with Mr. Simon Kay. Mr. Simon Kay is the head of corporate services. And currently in our system, 4 key branches of our corporate services are reports to him. So in Mr. Kay's team, we have Dr. Laura Angeletti Tutue. She's with the infrastructure and facilities management team. So she's joining us with her team. Then there's Ms. Esme Isaacs. And really, sir, I'm introducing you, Ms. Esme Isaacs and her supply chain team. Also on a sad day, this team has lost a key staff member. And this morning they had the memorial service of that staff member. So our deepest sympathies and condolences also go to the team, Ms. Esme Isaacs and her team from supply chain. Then there's Ms. Nonhlanhla Nkosi. She heads up our finance team. And she and the whole finance team obviously has been very central to all the work that has happened in this part. And lastly, I'm going to ask Ms. Rehana Shade. She's standing in for Mrs. Aris. She's the Director for People Strategy. So all the people management issues also is part of Mr. Kay's team. So Mr. Kay and all 4 of his teams are very central to the corporate services. And we're very proud of the work that's been done by that team. Then I'm going to go to Dr. Sadiq Karim. He's the head of the services. So as Dr. Karim was the one that had to face all the service pressures that came this way, he heads up a team of people that we're extremely proud of that has been able to respond with such agility in terms of the services provided across the whole province. Thank you, Dr. Karim. And then Dr. Vallabhji. Dr. Vallabhji is the head of strategy, and he and us all have obviously worked very hard, but Dr. Vallabhji proudly is almost like the father of all the things that made us very proud in this fight against COVID, and that is a data dashboard that is internationally recognized, a data science team, an epidemiology team that has guided us with evidence and data, and has made us proud in terms of that. Dr. Vallabhji, thank you so much for you and your team and the IT team and the assurance team and also your strategy and planning team that's brought us to this point. So Chairperson, it really gives me pleasure that on behalf of this team and many of the people outside in the department has done extremely hard work to proudly sit in front of you to account to Scopa of how we've used the resources after we've accounted to the portfolio committee this morning in terms of our performance. So I would say the same words I said this morning. This was a year where we came into touch with our humanity. And in terms of our humanity, the challenge has been that we've learned how to build human relationships, how to respect one another, and how to build mature relationships even in our governance arena as well. So with that in mind, I really would like to take my hat off, thank Mr. Kingwell and his audit committee. We've worked extremely well with him, and also for the mature leadership to guide us and to give me the assurance that I need as the accounting officer. So Ronnie and his team, I really want to acknowledge. Then also for Blanche and for Stefan and the internal audit team, we've built good relationships. And really, we're taking hand in hand to walk the path. And then obviously with Liesel and with Liesel and Gina and the AG team that we've done and built an incredible relationship in terms of navigating the complexity that we've had to navigate. So I would like to say to you, sir, Chairperson of Scopa, as an accounting officer and as a senior management team, we take our governance responsibilities extremely seriously. So even though it was an unusual year with so many unusual pressures, we doubled down and we stayed committed to clean governance, to ethical governance, and to do what we need to do to safeguard the resources, because we are called upon to do something and that is an honor for us to serve the people of the Western Cape. But we're called upon to serve with dignity, with integrity, with honesty, and to safeguard the resources that is entrusted to us. So thank you, Chairperson. This entire team, we submit ourselves humbly to your team, and we are here to account with humility, and we continue to stand to serve the people of the Western Cape. Thank you, sir.
Thank you very much, HOD, and also thank you very much to the Minister. That was mouthful, Honorable Minister. And now, honorable members, I'm going to allow you, those of you who've got questions or points of clarity or comment that would like to make on the report, but we are going to deal with the report in two parts also, bearing in mind that we are dealing with Part C and Part E of the report. Now, Part C of the report starts from page 101. Now, I would like to get an indication from members who would like to ask questions, would like to make comment on the report on Part C. We'll first deal with Part C. So those members who would like to ask questions in Part C, can I get an indication? I've already got an indication from Honorable Bartman. Honorable Barnes. Can you continue in that order? Honorable Kayako after Honorable Barnes. Honorable Bartman, can you start?
Thank you so much, Chairperson. And firstly, I would like to congratulate the Minister and the HOD and department and the whole team for this clean audit. It's absolutely phenomenal. Not only was this department last year the first department in terms of health in this country to ever get a clean audit, it has kept the clean audit despite a COVID year. And the annual report we see before us is essentially a COVID annual report. But Chair, my first question is related to page 102. And on page 102, you will see that risks have been identified for the department going forward. It's 11 risks, and out of those 11 risks, 8 are identified as high risk. And my question there is, in terms of medicine supply interruptions, how will this be managed? Is there a diversification of supply of medication, or what will be the way going forward? Load shedding has been identified as a risk. How will this be mitigated? I do know last year I also asked this question, and there has been generators in the department. So I just wanted to know what is the difference this year in it being identified as a risk compared to last year then, and how will this be managed? And staff burnout for me is a very big thing. So the fact that this is a risk, I would just like to know what is the provision in order to mitigate this. The health workers around the globe, in South Africa, in the Western Cape, have been through so much during the COVID pandemic. Our frontline workers have had to bear the brunt of this pandemic. And how will we ensure that all of the wonderful people that do work for us, that we are able to keep them within the Western Cape and in our system, that we're able to honor their commitments, to honor their work, and to keep them positive for the way going forward. And then I would also like to ask, it is not identified as risks, but I do consider them risks in my own mind. My first question is regarding, I do know that National Treasury allowed for a different methodology in terms of procurement during the COVID pandemic. And because of this different methodology, we were able to be more innovative in how we procure as a government and more innovative in how we bring services to people. And that innovation wasn't just for COVID, that innovation will allow us to continue going forward. But obviously, because the lockdown regulations have now decreased over time and eventually it will come to an end, hopefully. But that will change the rules for procurement from National Treasury. And we won't necessarily be able to do what we did during COVID in order to get the services to the people. So my question then is, how do you experience the procurement rules and implementation for innovation now compared to what you did during COVID, and how do we sustain the implementation of such innovative ideas? And the second risk that I don't see, but I do consider it a risk, is a question regarding intellectual property. As a country, Chair, South Africa has been one of the forefront countries, quite frankly, in terms of research, in terms of learning and experience and knowledge related to things such as COVID and vaccines and other diseases, quite frankly. And how are we ensuring that South Africa and the Western Cape particularly are going to benefit from the outcome of the research as well and the implementation of such research as well? Thank you.
Thanks very much, Honorable Partman. Honorable Barnes.
Thank you, Chairperson, for the opportunity. Let me quickly make mention that I'm sharing my gadget with Member Van Vogel. She's struggling with her, so I'll keep my hand raised so that she can be also recognized. I only have 3 questions, Chair. My first question is on page 103 under the topic cases, open cases as at 1 April 2020. What I want to know, Chair, is that what are the details of the open cases for both April 2020 and March 2021? My second question, Chair, is on the same page, 103, nature and investigation outcomes of 6 cases closed. Allegations were substantiated in the following 5 cases. My question, Chair, is for each of the 5 substantiated cases, can there be details provided and updates on these cases? My last question, Chair, is on page 112 under BBBEE Compliance Report, Department of Health 2020-2021, stating in addition, the department receives quarterly input from the Provincial Treasury on BBBEE compliance and performance. My question, Chair, is can the committee be furnished with copies of these reports for the 2020-2021 and 2021-2022 financial years? And what were the reports showing for this financial year? I thank you, Chair.
Thank you very much, Honorable Barnes. Honorable Kego. Honorable Barnes, you were saying that also is Honorable Van Vogel's hand also up?
Her hand is also up, Chair, on the same gadget.
Okay, so Honorable Van Vogel, if you may follow after Honorable.
Okay, thanks, Chair. I'm partly covered by Honorable Barnes. But what I want to understand is on page 103, on the issue of the 6 closed cases for 2020-2021, that the level of category of these particular employees that were involved in this, if the department would be able to respond to that. And also is that the nature, what is the nature of this, because we can't have a situation whereby cases are just closed and then we do not know what was the nature and then the level of management and then the category of the employees. Thanks very much, Chair.
Thanks very much, Honorable Van Vogel.
Thank you, Chairperson. Chairperson, my question is on page 105, the last paragraph. Can the department provide us with more details of the irregular expenditure and how did it occur and what measures are in place to prevent further occurrence? And then here on page 106, yes, paragraph 5, the third sentence. If the department can update us of, let's say, the
what are the updates regarding filling of these posts, and why was it not filled, and what is the profile of the persons employed? Is related to the ICU unit. The HOD give us explanation in terms of the post, the vacant posts and so on. So I'm not sure was it part of that explanation. Then, Chair, my last question is on page 112. Why did the department spend so much on non-complying companies, and what is the number and details of the non-contributors, including details of supplies provided? Thank you, Chairperson.
Thank you very much, Honorable Van Vogel. Department, HOD or Minister?
Thank you, Chairperson. I'm not sure whether the Minister has reached the documents, but if the Minister will allow that, I will proceed, if that's okay.
Yes, HOD.
Thank you very much. So thank you very much for the questions and for the comments. So thank you, Member Bartman, for the acknowledgement. We humbly accept the acknowledgement. I think in terms of the risks that you raise, I will cover some of them, and then I will just explain to you our high-level approach in terms of each one of these and come to your other questions. So number one, in terms of mitigating medicine supply, you will be able to see in our performance report earlier, which is about program 7 in the program report, you will see that we have actually mitigated during the COVID year medicine supply shortages quite successfully compared to the target we set ourselves. So we went into this financial year with an absolute shortage of medicine ingredients because it was all supplied in India and China. We went into the financial year trying to make sure that we minimize the number of or percentage of items that's out of stock in our depot. We've been able to work with the National Department around setting up tenders with predictable supply from suppliers and being able to mitigate the stock out. So our performance in the COVID year, actually, for stock out of medicines is 5% better than it was in the pre-COVID year. And that is mainly been to the proactive nature of our teams working on tenders and contracts with suppliers and getting predictable supply into our system. So one of the things that we are looking forward to is continuing to build on proactive engagement with the pharmaceutical industry about predictable supply. We are working with the National Department because it makes it, for the suppliers, it makes it easier if you have predictable forecast of use of medicines, predictable supplies and numbers, if it is done across all 9 provinces and with the National Department, because then the volume and quantity makes it more predictable for the suppliers. There's also plans to work with our National Department around international supplies, and therefore the availability of supplies in that context. So our team is working hand in glove, and the National Department has actually invited our team to become part of their process to stabilize and to strengthen the medicine procurement strategy for the country. And we're very proud to actually assist our national team in that regard. When it comes to load shedding, our department has done quite a lot of work. Dr. Angelita du Toit and her team has done a lot of work about having generators at all our facilities, having adequate supplies of diesel to keep these generators going. So we have very good systems as backup systems. And we've also looked at the utilization of electricity in all our facilities. So we're very much also, as part of a climate change endeavor, looking at alternate sources of energy. And we have lots of progressive work that Dr. Angelita du Toit and the team is doing in that regard. We've also been working with Eskom and with City Power as well, because of what we need to do in terms of how to protect hospitals in terms of COVID, And the relationship is one where we are now looking at also making sure that we can mitigate on an ongoing basis. We obviously understand that the Eskom situation is uncertain at this point in time, and all our teams are working with mitigation strategies, contingency plans to be able to mitigate at any given time in multiple ways. And then the last one, the staff burnout, is a very crucial one that you raise, Member Baartman. We're taking it extremely seriously. I think you can hear from the Minister. Our healthcare workers in an 18-month period has gone through an 18-month non-stop turmoil, and let's call it personal trauma, and personal fatigue. And in a sense, what we've had to do in a very organic way is in the second wave, we had to open the space for people to say, I am traumatized. I've lost loved ones, I've lost colleagues, I feel personally burdened, I feel that I'm overburdened, and then to be able to open and have that conversation so that we can actually have and launch something called intentional grieving and mourning, which was a very important first step in terms of opening the space for being a caring organization. So we've done a lot, we've reached out, we've brought clinics on site in terms of debriefing, in terms of people being able and comfortable to talk about vulnerability. In a healthcare system, we are open and tell people it's okay to cry, it's okay to be vulnerable, it's okay because everybody will have your back and we are in this together. So we are slowly building a culture which has been accelerated during this period of being open and being caring and looking after people in the way that we should be looking after them. That culture actually manifests that we are actually now attracting people that want to work in our culture. We have healthcare workers that says, this working with us, it might have been difficult, but there's so many people are saying they found meaning in life. They wouldn't want to work anywhere else because where they work now is giving them a culture fit. So we're taking it extremely seriously, and we have a people management team that we are so proud of, because our people management team has almost tapped into the pulse of our staff, and they can judge it, they can respond, and they can help us to work this forward. So we will be investing in our staff. So actually what has come out for us is our staff is our most precious commodity, and we will guard it with everything we can, and we will continue to work and invest in people and believe in them and trust them to be the best that they can be. So we're really on a journey of culture and building people. In terms of the other two questions, the National Treasury methodology, Minister Mbombo did make reference to it. The disaster regulations made provision for procurement enhancement, but Ms. Isaacs and her team, Ms. Baartman, Member Baartman, it's really a proud moment for us to say Ms. Isaacs and her team has really stepped to this plate, and they've set so many benchmark practices as a supply chain team. I don't think supply chain in this province, especially in the health department, will ever go back to what it was pre-COVID. So irrespective of the disaster regulations or whatever the situation is, our supply chain team has already launched themselves into a new way of being. I've not heard ever in my 28 years in our department how proud people on the front line is to say supply chain is our allies. What was before, oh, supply chain tell you what you can't do. Our supply chain team is, we're here to help you. We will get things, but we will follow due process. We will not break any rules. We have controls, and we will maintain good governance in terms of that. We think should be incredibly proud of our supply chain team because they've stepped up to that. And in that, we've got a centralized store for PPE. We have now actually established a really, really benchmark centralized supply chain non-farm system. And the team is incredibly proud of the work that they've done. It's taken a toll on them, but they've done incredible work to keep us proud in the way that the processes has been kept with due diligence in mind. Your last question about intellectual property. We have a lot of history in this province in terms of our relationship with universities. Now, because we have universities with us, we have 4 universities in the province. We are extremely proud as the health system that we have multilateral agreement with all the universities. Minister Mbombo will be chairing with the Premier in the next 2 weeks a joint governance structure, which she chairs once a year with all 4 vice chancellors of these 4 universities. And we will do a proud moment because during COVID, we signed after 9 years a bilateral agreement with each one of the 4 universities. The reason why I'm stressing that is that we have such a mature relationship with universities, and you can imagine that with universities, one of the key things we have to do is they are world-class researchers in their own right. And intellectual property is actually the expertise of universities. So we have very sophisticated measures in place for signing contracts with any entity in terms of preserving intellectual property right. And we're incredibly proud of the scientists that we have in our multilateral agreement with all universities in terms of due recognition for intellectual property. Member Barnes, I'm going to leave to the one person I forgot to acknowledge. I'm really sorry for that, Ruthwin, is that we have a very good relationship with the provincial forensic team under the guidance of Ruthwin. And we have regular engagements. We've built good relationship. And we have all the details that Member Barnes and Member Keiko is looking for. And I'm going to ask Mr. Simon Kay to provide the details of the open cases, the closed cases, and also the level of employees and the details associated with those cases. But then also on the BEE, the triple BEE treasury reports, which we get regularly. And then just to come to Member Windvogel's question about irregular expenditure on page 106. There's a detailed, and Mr. Kay will refer you to the pages in the last section, section E, where this is detailed, laid out of all the irregular expenditure, but he will give you a high overlay in terms of that. And then I'm going to ask Dr. Vallabhji just to talk to the ICU posts. It's a very good set of team. That 12 posts we're talking about, Member Windvogel, it's really an internal control team that looks at predetermined objectives or looks at our data. And Dr. Vallabhji will give you the details of those specific posts because they've been quite instrumental in us being able to get a clean audit in terms of the data management issues. And then I think also on the triple BEE, the non-contributors, Mr. Kay will give those reports. So Chairperson, if you're okay, I'm asked Mr. Kay to present those and then Dr. Vallabhji on the ICU post. Thanks, Chairperson.
Thanks, Doc.
Okay, thank you, Chair, thank you, members. I will try and keep my camera on, but it may fail, so I will then go behind the scenes. So the question regarding the fraud and corruption cases, the 7 cases at April were around alleged fraudulent administration by doctors at Tygerberg Hospital. There were 2 cases open for that. There was an alleged collusion by a service provider in a tender regarding the servicing of autoclaves. There was an alleged corruption of an award in the maintenance contracts at the Cape Winelands District Office. There was an allegation of irregular appointments of service providers servicing and maintaining air conditioning. There was an alleged fraud around a housing subsidy claim. And the final one was around a theft of old age pensions at Stuckland. The 4 new cases during the year were around allegations of fraud and theft at the Western Cape College of Nursing. There was a referral around an alleged fraud for the sterilization of business premises. The 4th one was an alleged fraud around GG vehicle fuel cards. And there was another referral around a fuel card specifically in the George sub-district. So in terms of the irregularities, Sorry, I'm just finding myself here. So this is the closed cases. So as indicated, the one case was the suspicion of fronting. That was reported through to the police, and that had to do with the generators. So that was around a fronting case. The second one was around the administration or maladministration by doctors at Tygerberg. There wasn't any criminal activity found in there, but more non-compliance with certain internal controls. The fraudulent housing claim subsidy, there was found to be non-compliance and a recommendation of recovery. The allegation of theft of old age pensions, there was no adverse findings that were made to substantiate that allegation. And the allegation of sterilization fraud, that matter was referred to the South African Police Service. And then finally, the allegation of fraud at the George sub-district on the fuel, a finding has been made. And action is to be taken against individuals as well as the contractual partner. So I think, Chairperson, those are the details of the various cases of fraud and corruption that have been investigated fully by the provincial forensics units that sits within the Department of the Premier. So the next question that I've been asked to address is around the triple BEE compliance and performance. We are able to provide the committee, as asked, with the reports that we received from the Provincial Treasury. But I just want to address the issue, and again, we've got the detail around the non-contributors. I think first and foremost, out of those non-contributors, around about R1 billion was for, let's call it intergovernmental and municipalities, and also where suppliers had not declared a BEE status. About 2.2 billion rand was where suppliers had declared a BEE status, but they recorded a score of 0. But again, we can provide those details. I think when we were dealing with the emergency procurement, it was more around quotations and not on the normal price and point scoring mechanism. And that's why we see a higher level of non-contributors within the BEE space. And then Dr. Cloete is correct. If I can refer members to page, sorry, I'll find it now. Page 227 and 228. But Chairperson, I will be guided because the detail is in those pages around the irregular expenditure and what.
Chairperson, Mr. K's Wi-Fi gets unstable at times. So the question would be, does the members want to detail? The detail is prescribed in page 226, 227, in terms of the full layout of all the irregular expenditure. And then on page 228, we go into details at the top of that, of all the details of what it was. And the main part of that actually is supplier not registered on the relevant database and no declaration of interest. And that mainly is linked to pharmaceutical supplies, where we have no option but to go to big companies for certain drugs to purchase it because of what it needs to be. But I will be guided by you in terms of further detail. I see Mr. K is back. I think he's answered all the questions. Mr. Dr. Balabji, around ICU posts?
Thanks, Dr. Kruti. So if I can just, on the ICU, for the last 7 or 8 years, I think it was around 2013, 14, that we created the Information Compliance Unit, and it's a team of 12 people. So we had most of those posts full, except the team manager, who the previous manager had got a promotion post. So this team basically focuses on seeking compliance with the PDO and information management prescripts. And the team is largely devolved to work within the districts and at facility level. And they really play a critical role in creating tools, doing samples of folders to just look at compliance with all the PDO requirements. During the audit process, they also play a key role liaising between the Auditor General's office and the facilities, and just helping with finding records and those kind of things, and making the information available. So I think, and the tools that they create are annually reviewed, because we have a kind of audit cycle, and all the PDO shortcomings that we find during the audit process are then included in the next cycle of improvements. So that's the pattern that we've had now for several years, and the team plays a very important role in achieving the clean audit around PDOs. The records management, there's a separate unit of 6 people that focus similarly on the records management aspect at facility level. Thanks very much.
Thank you, Chairperson.
HOD, there was just that list. There was the page that you said that the list of those issues that were raised are on. Which page was that? So that maybe when we take resolution, we can decide whether we want some of it in writing or not. Which page was it?
It was page 228, sir. On page 228, it says details of the current and prior year irregular expenditure in the current year. So it's under determination and under investigation, and it's a list of all of them. Yeah.
That's fine. We'll just decide. Maybe don't think we'll spend much time on that. Maybe when we are dealing with resolution, members might decide if they want to have more further information other than that. Honorable members, are there any further questions, follow-ups that you'd like to ask on section C? If there are no further questions or follow-up, honorable members, on section C, can we therefore then move to section E of the report of the department? And that section starts from page 159 on the document. Can I get an indication of members who would like to ask questions, comments, or points of clarity on the report? Honorable Barnes. Is it Honorable Barnes or Honorable Van Vogel? Or is it for both? Is the hand for both?
Chair. It's both, Chair.
It's for both? Okay.
Yes, Chair.
Can you can go for it then. In the meantime, Honorable Barnes, then we'll have Honorable Van Vogel, and thereafter Honorable Heko. In that order, honorable members.
Okay, thank you, Chair. My first question is on page 216 under local travel and subsistence. Road
Page
and
200. Page 200.
216, Chair.
Thank you very much.
Local travel and subsistence. Road and rail transport is the point of reference. Did the department contribute anything towards the red dot taxis? That's the question. My second question, Chair, is on page 217 under debts written off. Point of reference there is the supplier debtors. Can the department provide more details about this and why it was written off? My third question is on page 228, Chair. Details of current and prior year irregular expenditure added under current year. Point of reference is incident, Chair. For each of the incidents, please provide more details and remedial action. The second question on top of that question is, for the supplier not registered on the database, how did it get to the tender and what did it supply? What are the details of the supplier? My second last question, Chair, is on page 228, under the topic of 23.3, details of irregular expenditure condoned incident. Point of reference again, incident, Chair. For each of the incidents, can the department please provide more details and remedial action? My last question, Chair, is on page 228, under 23.4, details of irregular expenditures under assessment not included in the main note. My point of reference there is no procurement process followed. Why was the procurement process not followed? What exactly happened? Second to that, Chair, what is the number and details of suppliers that benefited and what supplies were procured through this? Which department were these PPEs procured for? Did it reimburse the 5 million? That's my question, Chair. I thank you.
Thank you very much, Honorable Barnes. Honorable Van Vogel.
Thank you, Chair. We are switching chairs now here. Chair, am I honorable? Can you hear me?
Yes, Honorable.
Thank you, Chair. Chairperson, my question is on page 162. The adjustment material misstatements. Can the department tell us what were the identified misstatements? And then page 194, Chair, the underspending, point of reference is underspending. To what extent is this underspending influenced by the closing down of clinics in poor communities? And what is the number of clinics that have been closed during the year under review? Then, Chair, on page 199, what are the details of the irrecoverable amounts written off and why have they been written off? Then, Chairperson, my second last question is on page 200. Cash flows from operating activities. What the question there is, what was the 550 million earmarked for, and what was it surrendered, and why was it surrendered and not rolled over? Then the last question, Chairperson, is on page 229, fruitless and wasteful expenditure. Can the department provide more details about fruitless and wasteful expenditure? Thank you so much, Chair.
Thanks very much, Honorable Van Vogel. Honorable Paigo.
Thanks, Chair. Mine is on page 195. With regards to transfers and subsidies to non-profit institutions, it is stated there that the under expenditure was as a result of non-profit institutions not fully utilizing their compensation to employees' allocations. So what we would want to understand is that whether the department takes back the funds already transferred to non-profit institutions if they are not utilized. That's the first part. And then on page...
Sorry, Honorable, it's on page?
195.
Thanks very much.
Sure. And then on page 216, an amount of more than 1.5 million was written off which was incurred from government vehicles damaged and losses in the year under review. So then we want to understand that why was such a high amount of money written off? What action was taken against those who damaged these vehicles? And then the third question is that on page 217, on debts written off, if you check the salary overpayments of more than 2.3 million are written off. What is the justification for that? And then on page 228, regarding the irregular expenditure, the incidents listed there are very serious and they involve millions of rands. How far is the disciplinary hearings and criminal cases for most of those incidents? And what is the department doing to make sure that incidents of this nature do not repeat themselves? And also, what is the reason for Provincial Treasury to condone those incidents outlined in on 23.3? Thanks very much, Chair.
Thanks very much, Honorable Keko. Department.
Thank you very much, Chairperson. Thanks to all the members. So these are referring, a lot of it refers to a lot of detail around the irregular expenditure. So that is the page 228 that I spoke about. So let me just do some broad overviews, and then I'm going to ask Mr. K to provide the details of most of these matters. So just in terms of Red Dot, it's a relationship that we've had with the Department of Transport and Public Works. Mr. K will explain what the relationship is and what the contributions from our side was to Department of Transport and Public Works, because it relates specifically to a service that we actually get for healthcare workers in terms of picking them up safely, taking them home in terms of that. Then the supplier debtors, Mr. K will give the details. Irregular expenditure, it will handle all the questions related to page 228 in one go. So the ones that's not regular on the database, the details, the incidents, no procurement followed, it will give all of those details. Then I think the issue about Member Windvogel, the issue about misstatement, the underspending, the written off, the surrendered, and the fruitless and wasteful, Mr. K will also provide the details. And then, Member Kego, I can talk to you about the non-profit organizations and COE. The issue is that we have a contractual agreement with all the non-profit organizations, and there is supposed to be COE paid for community health workers in terms of specific activities that they're supposed to perform. So there is a reporting mechanism between the NPO and the department, and you will see that some of that expenditure is because certain of the community health workers did not do the activities that they were supposed to do. Therefore, the money is withheld. We don't pay for work not done. And that is a reconciliation process, and that's why there's an under expenditure as agreed between the NPO and the department in terms of hours worked for specific activities. Then in terms of written off, the damage to vehicles, Mr. K will give a bit of detail, especially as well as around debts written off. And then, as you said, the irregular expenditure, just to make the point, which Mr. K will probably go into a little bit more detail, that the process of condonement is a specific process with PT. And it really is looking at, and as I said to you, the bulk of that irregular expenditure is actually about pharmaceuticals and pharmaceutical companies that we have to purchase medicines from. But Chairperson, if you allow, I think the detail, Mr. K can give much more specifics around the details as requested. Mr. K?
Thanks. Thank you, HRD. Thank you, Chair. Thank you, members, for the questions. So let me start in the irregular expenditure space, because I think Honourable Barnes, you asked about a system that we had around irregular expenditure. So there are different layers of internal control throughout our organization. Some are internal, some are external. And I'll just give a little bit of a broad overview of the system that we have. So the first layer and the first line of defense is your management controls. And these are for managers, but also personnel throughout the organization, and find voice in the delegation framework. Now, there are various delegation frameworks and something also called the accounting officer system. So that's the very first line of defense that says this is what we're supposed to do, and this is what the people are supposed to be doing below you. And as managers, throughout the organization, we are required to exercise the duty and the care that we have at that level. The second layer is, we call them DQs, but they are basically internal control specialists who go and do auditing of transactions after the fact. So we go and have a look at transactions throughout the whole organization, and we look at what we call the pakkies, and we test those for compliance or non-compliance against our AOS. The third layer is internal audit. An internal audit function resides outside of the department, but still within provincial government. So that lies with the department of the Premier. And we have a dedicated team that assists us and provides levels of assurance. The final level of assurance is, well, I should say, the final level of assurance is the Auditor General. And the Auditor General will have briefed you. The Auditor General did basically 3 audits with us over this period, the statutory audit, plus 2 special audits that looked at our COVID expenditure over the period. And in fact, there is a 4th one, but that is subsequent to this year, and that is around vaccines. So those are the levels of internal control that we have, and that we are quite careful to make sure that we maintain. Now, unfortunately, the reality is all humans are fallible and we do make mistakes. And irregular expenditure is invariably the result of that mistake. So the irregular expenditure is, in terms of the frameworks, primarily to do with non-compliance. So that doesn't mean that you have caused the state to lose money, but somewhere along the line, a box has not been checked. So, for example, and there's a question around the suppliers not registered on the relevant database. The 16.2 million rand that you see there is primarily around 2 companies, MQ Pharmaceuticals and Aspen, for a total of 11.2 and 1.2 million rand respectively to procure ARVs. Now, that is clearly something that is within the mandate of the department. That is clearly something that is for the benefit of our population. But that was the route that we had to follow in order to secure those particular supplies. And we can go on and on into each and every one of the different transactions, and there are a significant number of transactions with relatively low-ish values. So that then gets to the question Honourable Claypole asks around discipline and criminal cases and how the Provincial Treasury then condones. So there needs to be some kind of action, and discipline can happen in, well, criminal cases are where there is theft, but you won't find necessarily the irregular expenditure, the criminal elements disclosed under irregular expenditure, because when there would be theft, generally that gets disclosed as fruitless and wasteful expenditure, or under debtors, where the money is going to be recovered from the particular individuals. But the Provincial Treasury then has an independent committee that looks at all the evidence, and we are required to submit evidence by case, and they then consider the facts, what is put before them, and the appropriateness of the action that has taken place, and then they either choose to condone or refer back to us and indicate that they are uncomfortable with the action that we have taken and expect us to take a different kind of action. So that is then the process by which we manage our irregular expenditure. Now, there were some questions then around the fruitless and wasteful expenditure. So let me talk about the fruitless and wasteful expenditure. The fruitless and wasteful expenditure is on specific contracts that we are undertaken by our implementing agent. So that being the Transport and Public Works, which then we are referred to us, and then we conduct our own investigation on whether we are comfortable or not comfortable in paying the amount that we are asked to pay, and then we will deal with it appropriately and accordingly based on the outcomes of those investigations. So that's why you will see that it is recorded as fruitless and wasteful expenditure under investigation. The question about the 5 million rand, and that's in the irregular expenditure under assessment. So this was the funding that was provided by the provincial government towards the Ubuntu Mask Initiative, which was to create or to make cloth masks using local suppliers within the province as part of our public health drive. The vehicle that was used was the Health Foundation, and we have the relationship with the Health Foundation, and therefore the money was voted away from them and to us in last year's adjustment budget. The reason why it is sitting under investigation is that we are in consultation with our provincial treasury in terms of the correct disclosure or otherwise of this particular transaction, and we are taking it under advisement because they were intimately involved in the flowing of the funds by and between the various departments. So again, the masks were created and they were for public health benefits, and it was also used to stimulate SMMEs, particularly within the province and in the metro. So then there are some questions. Sorry, I'm just ticking through this. The question then on the red dot. So the Department of Transport and Public Works approached, we approached the Department of Transport and Public Works with a need. The first need was they were going to look after the Q&I for COVID, and therefore needed to be able to move people by and between COVID. So that is when, I must always get it right, I think that was in the green dot taxi operation then started. But on top of that, we then needed to be able to move staff from their work or their home place, because in the first quarter and even to the first half of last year, lockdown was quite significant and public transport was very restricted, but we still needed to be able to offer a 24-hour service. So the red dot was devised for us as a department, and for the whole year, we then transferred 51,989,371 Rand to Transport and Public Works. So of that 59 million Rand, 51.9 million Rand of that was for the red dot service. It has continued, it has been reduced quite significantly, but our biggest challenge is around Brackengate, because Brackengate is outside of the normal public transport routes, and therefore we have been transporting people by and between the facilities. And critically also early on, the red dot was the place where our healthcare workers felt the most safe, because there was a significant reduction in the number of people that were allowed per vehicle. So I think the maximum was allowed, I think it was 7 people per vehicle to move staff, and they felt a lot more protected by that particular intervention. So then I'm going to go to the GG vehicle loss. I mean, the reality is that we have about 536 million rands worth of vehicles, GG motor vehicles. And the reality is that there is a concomitant of having those, that vehicles will get damaged and vehicles will get into accidents. Again, each situation is assessed accordingly. If there is somebody who is accountable for causing an accident or for causing the damage that can be directly attributable to them through a process, then a debtor is raised up against them. But if not, then we are the insurer, ostensibly the state. We don't take insurance, we self-insure, and therefore we see these expenses that are coming through. So in that we have, it's 0.2% of the total value of the fleet, which is actually down from 0.5% in the previous year. So it's going in the right direction. Then salary and tax debits. So invariably these arise when people leave the department, and when there is a difference or due to timing of the resignation or termination, they are not necessarily removed from Persal in time for the salary run, and then they get paid a salary or a part of a salary, and then we have to go and recover those debts from the ex-officials. This can be quite a tedious process, but there is a process that is involved that we do try and recover those debts from the various individuals. Suppliers' debts. Supplier debts occur when contracted suppliers are unable to provide stock, and the department is then forced to purchase an item from another supplier at a higher rate. So this is in the pharmaceutical space. So there are contracted values, and if the supplier is unable to procure at that contracted value, there is then a penalty that is basically added because us as a department have procured at a higher value. We then raise that as a debtor, and we then deduct that against the creditor at the next available stage. This is a practice that we will continue with, and I think is actually quite successful. Sorry, there are a number of questions that have been asked. Then the question around the expenditure. So in order to, I think the question is around earmarked funds and whether we can or cannot roll those over. So when you have an under expenditure, you are required to surrender that under expenditure back to the provincial treasury, to the provincial revenue fund. You can then apply for that as a rollover in the adjustment budget process of the following year. And that's what we are doing, and that's what we have done. Primarily, that budget relates to the COVID-related expenditure. We didn't know how much we were going to need, so we were given funds on an estimate. That estimate was a little bit high, and therefore it resulted in a under expenditure or a saving. That saving will then be and is being applied to the current year and will fund ostensibly our fourth wave, which we are anticipating to still occur in this financial year. So that's why we don't retain that money. That money must go back to the provincial revenue fund, and then it gets appropriated to us through the appropriation bill, which is, I think today is the day for the finalization of that. Chairperson, I think I have covered everything. If I haven't, please will you just let me know, and then I will go back to that particular page and answer the question. Thank you.
Chairperson, maybe I can add. I think Member Windvogel was asking whether the under expenditure resulted from any specific clinics being closed and whether it was in the rural areas. There were no clinics closed. What we are talking about is a general expenditure that was actually a saving that we rolled over in this year to deal with COVID. Because of COVID, there was lots of services scaled down, but no specific clinics were closed in any of the rural areas or any that is responsible and linked to this. Thank you.
Thank you very much, HOD and Mr. K. Honorable members, any follow-ups questions or any further point of clarity if maybe you think that your question was or was not covered? If there are no further questions, then honorable members, I want to check if are there any comments maybe from the audit committee? Are there any comments from the audit committee? As I were about to round up the meeting, Mr. Kingwell.
Thank you, Chair. Yeah, and as you see, the department has been very thorough, both in their preparation, and that's how we see them coming to our audit committee meetings as well. Always very well prepared. And as I requested in our briefing, I just wanted to make the statement that any department that has as complex as the Department of Health, be it of this province or any province that has been through a year that they've been through, to come up with a clean audit at the end of the day with the sort of interrogation that both the external auditors provide, the internal auditors, the audit committee, and then on top of that, we have had national investigations as well with the supply chain. And then on top of it, SCOPA is fulfilling a very crucial role in accountability. And yet, each time, this department is coming up very well prepared, very thorough, and I want to use that opportunity, thank you, Chair, to say to the department, you can be extremely proud, and I think all the team, right down to the lowest level of the organization, needs to be commended on their commitment to keeping the system going and to look after the funds that have been allocated to them in a responsible way. So, Chair, to Dr. Klute and his team, to Minister, for your commitment on behalf of the community of the Western Cape. Well done, and thank you very much indeed.
Thank you very much, Chairperson. AG, as we are about to round off, are there any comments you'd like to make?
Chairperson, thank you for the opportunity. No, there's no further comments from our side. Thank you.
Thank you very much, AG. The HOD?
Chairperson, oh, sorry, the Minister is there.
HOD?
Okay. Thank you very much, Chairperson. I just want to say to everyone on this committee, thank you very much to the committee members. We really pride ourselves on being accountable. And as part of your oversight function, thank you for asking the questions. Thank you for asking us to account, which we gratefully and gladly do. And humbly we submit to you. Thank you for the oversight that you perform. But again, just as Mr. Kingwell has said, to our colleagues in Auditor General, internal audit, and in forensic pathology service, forensic services, provincial forensic services. We really thank all the partners that we've had in this. As an accounting officer, sir, I take combined assurance extremely seriously. Part of what is entrusted to me as an accounting officer is to make sure that I do everything to make sure that the resources entrusted to our care is used responsibly and with due diligence and oversight. So combined assurance is extremely important to us. And in that vein, I would like to commend every single person in our department that's gone the extra mile to make sure that we can proudly say all the resources we've used has been responsibly used. So thank you very much, Chairperson.
Thank you very much, HOD. Mphathiswa.
Enkosi Sihlalo.
Ngifuna ukugqibela ngawe.
No problem. No problem. No problem, Sihlalo. Sorry, I won't be able to put up my my camera.
Sure.
Just want to firstly to thank the internal audit committee, specifically Mr. Kingwill, which I think it's gonna be, I think his term ends by the end of the year. So I'm not sure at this stage whether there will be is gonna come back in other committees that will be appointed. And he has been with the department, not with the department, with the Western Cape government in other departments, because when I started in 2014 as the Mphathiswa in the DCAS, he was also part there. So I think more than 6 years with the government. So thank you very much, Mr. Kingwill. I know that in the past we have been sometimes gets difficult to work with because we see ourselves as also we know this thing. And then we are being also reminded that it's not about not knowing. We know you know postpartum hemorrhage, you know high blood pressure and all of those, but it's about the principles of the. So thank you very much for being able to be there and guiding us, and also your knowledge of having served in other committees and also even communicating with your colleagues with the other committees. It did have a positive contribution, especially in the space of infrastructure. Our frustration, us as health, as the client, and the public works, for example, as the implementing agent. But you managed to give guidance throughout, knowing both of these areas. Thank you very much. All the best. We'll see if again that we might maybe our path may cross within the space of the Western Cape government. To AG, we came a long way. We came a long way with the AG. Ms. Kloo, Gina, and the team, everyone. Thank you very much again for allowing us to be difficult, for me specifically, to throw my tantrum sometimes. But I think probably with this report, where at least we could be able to do things virtually, probably there was a breather, because when we used to meet each and every quarter on the 21st floor, especially even the time we said that, how come that you will give us a finding on this legal thing? And they said, Minister, it's not about that, it's about the threshold. This little thing times 20, that's what actually contributed to unqualified audit. Probably if there was lesser of these little things, you might have been able to get the audits, the clean audits. Thank you very much, especially during the time of this budget report, where you have to do both. There was a time that there was even a delay of the report. You also have to do the COVID, the PPE, as according to the national requirements from National Treasury, when they introduce the auditing of the PPE. And I'm aware that you are busy now doing the special report 3, if it's going to be required at the national level, but implemented each and every province on the vaccination. But in the phase 1, I think things were quite difficult for us. That's why I keep on also reflecting on the supply chain team, where they have to audit everything related to the PPE. Because the last time when I went to the depot, when we used to have our PPEs in the depot, which is the old Good Hope Center hall here in Metro, where everything was everywhere, I kept on wondering how would they be able to do that? Because the AG said that we have to audit everything. But thank you very much for being with us throughout. We don't take lightly the issue of getting the clean audit. We respect you because it's not only about sitting, it's about going to those areas, getting to see those infrastructure. I want to see this Laingsburg clinic. I want to see whether these children have had really the teeth, the dental care as according to the wellness. Thank you very much, the AG. And to the team, Dr. Keith Cloete and your team, it was a really that year that we'll never forget. I'll never forget that year. And some of us, specifically from the nursing side, the excitement was going to be the year of the nurse, the year of the midwife. We had so many plans. Some of us who were appointed back as MEC for half, for me it was exciting. I said, oh, if you have seen me in year one, now it's my second term, watch the space. I'm just going to revolutionize the health system. All those things that I used to read, the big books at the time was in academia. I said, come UHC, Universal Health Coverage, I'm here. I've got the space. Come the community-oriented primary care, I'm here. Come to addition of the people's system as part of the health system. It was quite exciting when I said I'm coming back. When I came back, I was appointed again in 2019. Unfortunately, the dreams were deferred. 2020 changed everything. And your team actually, even at the call phase, because especially when it comes to the auditing, if the AG says you want program 2, district health services, we're going to go to Laingsburg Clinic, we're going to go to Gansbaai, we're going to go to whatever, it means those people there, the staff that are there, they have to ensure as a call phase control unit to make things that ensure that things are happening. So we want to thank you, Dr. Cloete, and your team on behalf of everyone else. And also for you, when you came at the time, March 2020, is when you said you are officially, you are HOD. Yeah, but there's also COVID. And in addition to that, every Wednesday, you'll be addressing, presenting to the cabinet. Every Monday, it's going to be extended cabinet with all the mayors involved. You've become, all of a sudden now, being a media person, all of a sudden when it used to be the spokesperson of the department. So thank you very much and your team for all of those. My colleagues, Chair, and also the members of the honorable members. For me, it's not only about thank you for these specifics, but also across for the whole year about this. Not only we kept us on our toes, but also even at the time that probably there might be some tensions. We didn't take it personally. We could understand that it was the fear of the unknown. Everyone was so scared about this pandemic, and also the lockdown system. I mean, the lockdown and also the disaster management. It made at the beginning that everyone must be locked down, including you guys. And then some of you kept on saying, "When are going to start with the oversight?" And then we said, "No, stay at home." So I can understand the frustrations. Some of you as constituency head, you'll be asked questions and you want to go and check what is happening, but you couldn't be able to. So we understand that part. In the context of this, probably the AG might have indicated, actually might have seen it in some of the pages or elsewhere, that we have always been putting it as in future, not yet pronouncement, issues like what you call it, componentization. I don't know how to pronounce the English word, but also inventory. These are some of those things that some of us also have got no clarity on. But going forward, Chair, you may ended up having now to deal with those kind of issues that haven't been pronounced yet when the Treasury pronounce. And also, we still, whilst we are happy about the clean audit, but there are also gray areas in regard to how will those, when implemented, might impact on us in our auditing, which might not necessarily is our core functions. For example, the local content in the use of the steel products and all of those, how it may impact on us. Yet we don't put much of our, in terms of the infrastructure, because we are the client of the public works. We might do minimal in our space through the refurbishment and the maintenance, but the bulk of it goes elsewhere. We don't know how it's going to impact on such. We don't know how it's going to impact also in some of the national directives or instructions related to some of the regulations within the PFM space, where we'll say that before we implement this, let's have an argument. Just I think there was in earlier when they were asking from the SC asking about the Jooste Hospital, where it was indicated that there were some of the issues that were not clear from the directives from the National Treasury versus the implementing agents in terms of what are the clear guidelines, or with that some of the delays, it was because when there were some objections, because some of the clear guidelines were not there. So what I'm trying to highlight is about there might be some other input that are related to the health financing space, that where we might end up where we're so excited with the clean audits, probably take us even down if those are not implemented, although they are not necessary within our immediate space. But thank you very much for this opportunity. We're looking forward for appropriation. I think it's on the 9th December, I can't remember, but also to present the report of the 2021-2022. Thank you very much, Chair. Over to you.
Thank you very much, Honorable Mphathiswa. Let me also make use of the opportunity to thank you and your department as the political head of that department for the leadership you gave, as well as to the HOD, who is the accounting officer of that department. Thank you very much for the presentation that you have done, have made in front of us. It is also our responsibility to conduct our job of oversight by holding the executive accountable, and we were doing just that. And as you've indicated that there is no we do not mean to actually trick the department or trying to be difficult on the department. We are just exercising our responsibility. And thank you very much for the cooperation we have shown and we have given. And obviously, it might not be the last time again we will be calling on the department. Normally, when we meet again as a committee in taking a resolution, there might be indication that some of the members might say, look, there is this thing that is not clear. Can the department maybe come back again and explain this thing further to us? Again, we're not trying to trick you or trying to be difficult with that. We're just playing our oversight role of actually holding the department to account from time to time around the use of the resources of the provincial government. So thank you very much for that, and thank you very much HOD, thank you very much Honorable Minister, thank you very much to the AG, thank you very much to the Audit Committee as well. We may now excuse you so that we can continue with the business of the committee. Thank you very much.
Thank you very much.
Thank you, Mphathiswa.